Well, I welcome you back to another episode of Someone You Should Know. We're going to have a very informative conversation today. I think you're going to really enjoy it, especially you women, because it's kind of geared to you, although we haven't forgotten you guys either. And we are brought to you by our good friend Christine Dean, who is the networkingdiva.com, thenetworkingdiva.com. Now, Christine Dean has been involved in this show as the producer and sponsor of this show for many, many years. And over those years, she has continued to grow what she does in helping people market their businesses, their websites, their whatever they are doing. She can help you make it better. And you can even reach out for a free consultation to Christine Dean and all to see if your business is doing the right things, or maybe it could use a little bit of tweaking and all. She's a master at what she does and all, and I guarantee whatever you are doing with your website, she can help take it to the next level. Christine Dean, thenetworkingdiva.com. Reach out. Thank you very much, Christine, for all that you do for our show. Well, I often do shows about medicine and all because I think that not only is there a lot that we don't know about medicine, but an awful lot that we should know and can learn about medicine. And there are so many different forms of medicine and approaches to it that I have reached out to a young lady who I think is extremely interesting and unique in her approach to business. So I welcome Dr. Debra Muth to the show. Thank you, Dr. Deb. I very much appreciate you joining us.
Thank you for having me. It's a pleasure. I'm excited to chat with you.
Well, you are right off the bat. One of the first words that popped into my head was that you are a naturopathic doctor and all. And I want you to define what that is for the people that are watching and listening.
Yeah, it's the best of both worlds ultimately. So we're trained in some conventional medicine. And I had training as a conventional nurse practitioner before I became a naturopathic doctor. So I understand conventional medicine very well. But I think the brilliance behind a naturopathic doctor is looking at things from that natural approach. Where can we employ lifestyle, diet, nutrition, supplements, herbs, things like that, that can really help to rebuild the body and heal the body the way nature intended us to, the way God himself gave us all of the
Mhm.
wonderful things on this earth to heal ourselves. And that's the glory about it. A lot of the drugs that we use today originally came from plants. But unfortunately, what we think about that is we found one part of the plant that did all the work, and we didn't think any of the other constituents of the plants did anything. And the wonderful part, again, about naturopathic medicine is we realize that everything works better as a whole versus us just taking out one ingredient and saying, this is the main thing. We realize there's important parts to every part of a plant or a supplement or a nutrient. It works better synergistically together versus as a whole. So when we work with clients, we look for the root cause. We're trying to figure out what causes the issue. Once we figure out what causes it, we can employ natural techniques to fix the problem instead of just giving you a pharmaceutical to mask the situation and the symptoms.
Well, I think it's fair to say that you may have two patients that have the same symptoms and all, and yet the treatment method might have to be tweaked a little differently for each one of those based on family history, heredity, and other issues. So that approach might be a little bit different with two people that have the same malady. Am I correct?
Absolutely. Just even being male and female makes a huge difference. Unfortunately, in conventional medicine, we're taught that women are just smaller versions of men, and that couldn't be farther from the truth. Our hormones are different, our genetic makeup is different. And so that's where we look at this and say two people cannot be treated exactly the same way. And you're absolutely right. Your hereditary factors, your genetic makeup. And you have a mom and a dad, and they give us all the wonderful genetics. But even amongst family members, a brother and a sister could have different genetics because mom and dad gave them each different genes. And depending on how they all came together, they may not respond the same, and we may not see the same problems in the family. So really looking at every person as an individual and treating them as that individual makes the success or the failures amongst treating them.
And also something that has always been an issue for me is, and I'm just going to ask you straight out, do you feel that today we live in a society that spends so much time treating symptoms instead of treating the cause of those symptoms?
Absolutely. In our 15-minute medicine appointment that we get, it's impossible for you to figure out the root cause of what's going on. So we treat a symptom, and then we develop a side effect of the medication that we gave. So now we're giving you another medication to treat that symptom. And before you know it, you have 5 or 6 different medications that really aren't addressing the problem in the first place. You're just chasing your tail and chasing symptoms. And if we took the time to really listen to the story of what happened to the person and talk about their lifestyle and what they've been exposed to, we can find a lot of those answers in about a 45-minute conversation. It doesn't take as much time as people think. You just have to be willing to listen and understand the key points. They give you the answers in your story all the time.
And I have found over the years that when you are prescribed one medication for one thing, and then another doctor may give you a medication for something else, that sometimes those two medications don't necessarily agree with each other. And so it leads to another medication. And I have always felt that having a good pharmacist on your list is very good too, because a pharmacist looks and says, oh, you're taking this. Do you take that in the morning or in the evening? Oh, you better separate that from this other medication that you're taking. And I think that today, our society, we're just too quick to, like you said, you meet with the doctor, first thing he says when they walk in the door is how you feeling? And you say, I'm feeling pretty good. Then the conversation goes a little bit deeper of how are you doing with this? Okay, well, I'm going to prescribe this to you. And I think that there's a lot of people that don't feel that badly about, okay, fine, doc, I'll start taking that medication. I'm kind of anti-medication. I don't really feel good about taking a lot of medication. And in your practice, what you're trying to say is that there are some natural things that you can take that may be as effective, if not more effective, than something out of a bottle.
Absolutely. And I agree with you. You need a good pharmacist to be able to look at what you're taking, because the other problem that we have, if you see multiple specialists, they won't take off a medication that someone else prescribed, and they won't tell you to go talk to the doctor about what they prescribed, and or let them know that I'm prescribing something different. And so it may be 6 months that goes by before you see the doctor that prescribed the first medication. And then all of a sudden he's like, whoa, wait a minute. If you're taking this, I didn't want you to be on that. And there's just not great communication, even though we have an electronic system that's supposed to make all of this communication better and easier. It's just not happening. We're not seeing that communication happen between each other the way it should. So having a pharmacist to say, wait, these interact with each other, or you shouldn't take them together, or don't take them with a calcium supplement, just things like that can make a big difference in how you get outcomes. So it is definitely something. We need a team of people to take care of us today, not just one person. And there are a lot of natural things that we can use that I believe we should be using before we prescribe medication. If the natural things fail, then prescribe medication. And we shouldn't just assume that somebody's not going to change their lifestyle, so let's give them a drug. Let's give them an opportunity to teach them and get them to change their lifestyle and see if that makes a difference before we give a medication.
It's a good point. And also, we all have the internet in front of us constantly. And I think it behooves people to also do your homework. That when you go to the doctor, if you're having certain symptoms and maybe read a little bit about those symptoms and read a little bit about what that disease is, because when the doctor says, I think I'm going to prescribe this, and you say to the doctor, well, I know, but I noticed that one of the side effects is headaches, and I have migraines. So am I going to be doing myself an injustice by taking this medication? And the doctor may say, well, yes, okay, let's go a different route.
Mm-hmm.
I mean, an informed patient, I think, is a better patient for the doctor too.
Absolutely. We've joked a long time that Dr. Google is our friend and our foe. But even today, ChatGPT is diagnosing people and giving recommendations of medications and supplements. And we always have to be careful what AI is telling us, because AI
Right.
is only as good as what's on the internet. But it can certainly give you a lot of information and appropriate questions to go back to your practitioner to say, I read this. Is it true? Or does this apply to me because I'm an individual and I'm separate and you know more about me? It's okay to ask those questions. Don't feel bad about asking the questions. You have every right. You're paying that doctor to be a service to you. And you have every right to hire and fire them. And you have every right to ask the appropriate questions. We ask more questions about buying a house than we do about our own bodies sometimes.
Never thought about that, but you're absolutely right. People will really dig deep when they're buying a car or buying other items and all. But when they're trying to solve an issue with their own bodies, sometimes they say, "I'll just leave it in the hands of the doctor."
Yeah.
Well, that's fine, and I don't say you shouldn't do that, but I think it's also fair to say that if you know that you're having a problem with something that maybe your father or your grandfather had, and it is hereditary, then that's something that the doctor needs to know also, because that will make a difference perhaps in what the treatment method is.
Yeah, you know your body better than anybody else, and you know your medical history better than everybody else. Back in the day when doctors treated you and your parents and your grandparents and your aunt and uncles, they knew everything about your family history. But today we change doctors every couple of years as your insurance changes, and they have to treat so many people. It's impossible for them to remember everything about everybody. So it's really important for you to share that information with them so they can make the best choices for you, and you can make the best choices together as a team, not just letting the doctor make the choice and then blaming them when it doesn't work. You have to be part of that team. You have to be willing to open up and say some things that you may not, think they're going to respond well to, but you'd be surprised how many times that saves you from having a mistake or an error because you said something and you spoke up.
You are in the Milwaukee metropolitan area. Has your practice always been there?
Yes, always been in Waukesha, Wisconsin. Mm-hmm.
Okay. And which folks, by the way, if you ever have a chance to go to Waukesha and the Milwaukee area and everything, it's a lot of history, it's a lot of culture and everything. It's a great place, and Wisconsin has great cheese.
Yes, we do.
And just in case you have an allergy to it, you need to go to somebody like Dr. Deb to say, why am I reacting to this?
That's right.
But your website is serenityhealthcarecenter.com. We've been scrolling it, and folks, I encourage you to just jot that down and visit the website, because you can not only see the various things that Dr. Deb is doing and all, but you even have an opportunity on the website to reach out if you have a question or an inquiry for her that she might be able to help you in a direction, no matter where you're located. But it's a wonderful website filled with all kinds of information. And as I started scrolling down through the website and everything, I was particularly interested to see it. In the beginning, I thought that you really kind of focused on women's issues, but you also deal with a lot of male issues also.
Yes.
And it's not a one size fits all kind of thing, because in just I think we're coming right up on another area right there that says some of the things that you're working with. Naturally with women, of major concern is PMS and menopause and the aging process, but that also works with men too, because men go through all kinds of changes as they get older. with male issues and all. So, are you finding that as we age as a society and all, that there are more issues that are starting at a little bit earlier time?
Mm. Most definitely. You know, we have menopause for women, we have andropause for men, and it happens the same way. Our hormones decline as we age, but what we're seeing as we're exposed to more and more chemicals in our environment, and to date, we know there's at least 80,000 different man-made chemicals that we deal with in our environment.
Of
It's starting
course.
to disrupt the hormonal process even sooner. And then when we look at all the people who've had suffered from head traumas in our lifestyle, men more prone to this than women particularly, we'll see a reduction in hormones even faster for men if they've suffered a traumatic brain injury. And we all know, you know, bicycles and sports and all the wonderful things that you guys like to do unfortunately can cause a traumatic brain injury. And it doesn't have to be to the point where you knocked yourself out and you blacked out and you don't remember for 30 seconds. It can be that experience where, you know, I was playing football and I was able to get back up, but boy, that really rang my bell. And I had a couple of seconds there where I wasn't sure what was going on. But as we all know, we're not going to say anything because we don't want to get taken out of the game and we want to keep playing. Well, that's going to show up 10, 15 years later when we start seeing hormones decline. And even today, I've been doing this a long time. I've been doing this for 25 years, and we didn't see issues with hormones declining, men and women, until they were probably in their late 40-ish, early 50s. But I'm now starting to see young guys in their 20s and early 30s that have very, very low testosterone levels. Women have some disruptions as well, but I don't see it as much in younger women as I see it in men. And that early age of testosterone falling really sets men up for a lot of diseases, heart disease, infertility, depression, anxiety, all kinds of things can happen when they don't have their hormones the way they should.
Yeah, you know, and also our society is aging a little bit later
Mhm.
too, and so those of us that are getting in their 70s and 80s and everything don't want to give up that tennis, or they've
Mm-mm.
gone to pickleball and maybe because it's a little less
Mhm.
involved than tennis, but you don't want to give up those things, and yet those may be causing some issues of with joint pain and issues like that.
Mhm.
Uh, I know that one of the things that you work on a lot on, and it's listed on the website, is allergies. And
Mhm.
I have just seen, in my years that people seem to develop allergies, more and more allergies as we get
Mhm.
older. And it's probably because we are exposed to so many things. Certainly, COVID threw us all
Yeah.
haywire for a while there. But even because we are a more transient society, you said you spent your whole career basically in the Waukesha area, but
Mhm.
sometimes people move from one part of the country to another part of the country. People in the northern
Mhm.
tier, as they get older, sometimes want to retire to Arizona, to Florida,
Mhm.
whatever. And now all of a sudden, you're in this new atmosphere, and all of a sudden, you can't figure out, why am I sneezing and my nose is running all the time?
Mhm.
Because we are so right away. Run to the allergist and you get a prescription for this pill or that pill
Mhm.
to and that's what I said earlier in the show. That's treating symptoms and
Mhm.
all. So, what do you say to people that have allergies or are developing allergies? Is there a process that you really need to consider going through to identify what is that allergy? What is causing that allergy in order to eliminate the cause to make you feel better instead of just throwing the medication in?
Absolutely. So the first thing when we're dealing with allergies is we look at a person's gut function. 70 to 80% of our immune receptors are actually in our gut. And so when you've never had allergies before and you're starting to develop allergies now, we want to look at what's changed with the gut. And is there a bacteria? Is there a virus? Is there a fungal overgrowth? What's
Wow.
tanked the immune system in the gut that has now made you susceptible to these allergies? Whether it's environmental allergies like grass and pollens, or it's foods, it's always going to stem from the gut and that immune disruption. And so if we can figure out what's causing the gut to have an improper immune balance, we can fix that, which then starts to fix the allergies as well. Allergy testing, I think, is really good. The conventional allergy testing is not as accurate as functional allergy testing. When we do a little bit different testing, it's very similar to what we call prick testing in the conventional world, but it goes a little deeper. It's more intradermal in nature. And if you look for somebody who's trained by the AAEM group, it's the American Academy of Environmental Medicine group, they know how to do this type of allergy testing, and they treat you with sublingual drops instead of treating you with shots. But they will look at your gut function and they will treat it from a different perspective. So they can get the immune system to start recognizing these things as non-allergies again. So you can tolerate the environment around you and eventually even be able to tolerate foods that you were never able to tolerate before. So it's really a big process of looking at that gut and healing the gut lining.
For those that are watching and listening, again, the website is serenityhealthcarecenter.com. But there's a particular thing on that website that I want you to be aware of too, and there's a button there for blog, because you also are a podcaster. And you've done, I think I saw you're well over 250 episodes already. And you also have a secondary website, and it's called letstalkwellnessnow.com.
Mm-hmm.
I'm throwing that out there, but that, if you click on the blog button, it'll lead you there too. You have some phenomenal conversations about different areas of medicine and interacting with people and everything too. And it's very, very informative. And folks, anywhere you are in the country, you have got opportunities to share some time with Dr. Deb and listen to some of the things that she is interacting with other people about. Your conversations and all are quite well done. I applaud you for that.
Thank you.
And there is absolutely a world of knowledge to be had from listening to some of the episodes that you have, and I encourage people to drop in and listen to some of them. Do you enjoy doing your podcasts?
I love it. I really do. I started it a few years ago and I wasn't sure I was going to like it, but I get to talk to some of the most amazing people. And I learned so much from them. As much as everyone learns from me, I get to learn from them and get to make connections with people that I normally wouldn't be able to do if it wasn't for the podcast. So I just love it.
Yeah, it's fuel for your fire too.
Mm-hmm. Absolutely.
I've been doing this show for over 10 years now, and that's over 500 guests.
Wow.
And I'm fascinated with most of the people that I have the opportunity to interact with also.
Mm-hmm.
And it's informative, and it's there for us. It's right there on the internet. You can reach out, whatever platform that you're following. But the important thing is to just drop in and see what it's all about. And when you're listening to some of Dr. Deb's interviews, I guarantee you're going to walk away with some knowledge. And isn't that helpful for you when you're trying to determine what your next step is with your medical life?
Mm-hmm.
So it's important to be able to do that. There's something I want to ask you about, because I was looking over some of the information about you, and I may mispronounce this, but there's something that was listed as mitochondrial dysfunction. Did I say that right? You
did. Great job.
What is that?
It's a big fancy word for cell structure. So our mitochondria is just our cells. And when the mitochondria gets depleted, our cells get depleted, or they start to lose the way they are fed by nutrients like amino acids and vitamin C and vitamin B. They don't function as well. And so you can get fatigue and you can get brain fog and you can get muscle pain and joint pain. And so it's a great way to just rebuild that cell and get that cell to function the way it's supposed to.
Thank you. Now I'm more aware. You see, I told you folks, you can learn something from this program.
Yes. We have to make things so complicated in medicine, right? We can't just say cells.
Right. Oh, that's what you mean.
Yes.
The long version of it. It just sounds more professional when you say the big words. I'm going to switch gears on you just a little bit.
Yeah.
Because I also read that you are in the process of writing the book, or you have written the book.
I have written the book. It's in the process of cover design right now. So hopefully it'll be out by probably early September-ish. Mm-hmm.
And it's a departure from just the medical side of you, because you are the patient. The title of the book is "If Not MS, Then What?" And I want you to explain that title and what it has to do with Dr. Deb.
Absolutely. So we just changed the title to Seen at Last, but it is exactly that. So December 23rd, 2022, I was given the diagnosis of MS from my orthopedic surgeon. I went in post-COVID complaining of some numbness and tingling, and I've had a lot of neck issues, a lot of trauma in my neck, and I just assumed it was my neck. And as I was sharing my symptoms with him, he looked at me and said, "You're a really bright woman. You know this isn't your neck." And I went, "What are you talking about?" And he's like, "Come on, And I seriously had no thought he was coming across this way to me. And he's like, "I think you have MS." And I just kind of laughed and I said, "No way, this is not MS." And he said, "Just enlighten me and go get a brain MRI." And we joked a little bit. And I said, "You just want to see if I really have a brain or what?" And he said, "I know you're smart. So go get that brain MRI." And I got the brain MRI, and when it came back and we saw that there was white matter brain disease, and I went, okay. So in his world, white matter brain disease meant that I had MS. In my world, I said, this isn't MS. This is toxins, it's mold, it's Lyme, it's something else that's causing the scarring on the brain. So I did what I do for all of my patients and started going down the path of trying to figure out what was causing this white matter brain disease. And 18 months later, I did not have a diagnosis of MS. I no longer have white matter brain disease. And I actually grew my gray matter in my brain, so where your memory is, by 2 standard deviations in less than 8 months. This is impossible. This is never supposed to happen. We're taught that once we have white matter scarring, it will never go away. And once your brain starts losing volume, there's no way you can get it back. And I defied that. And so the book is about my journey and what I did to restore my brain function and completely reverse MS. Do I say I still have MS? It's a diagnosis. It doesn't really mean anything to me. I think if I would not have done what I did, there would have been a completely different outcome. And I think for people who get that diagnosis and don't get put on the right path, they're going to have some struggles and they're going to have some things we can't reverse, unfortunately. I was just fortunate enough to know that I didn't have to accept that diagnosis and I didn't have to accept their immune suppressing drugs. And there was a different outcome for me and a different outlet that I could go to. And so that's what the book is about. And it'll walk people through exactly what I did, how I did it, and what to look for and what kind of conversations to have with your doctor if you want to do the same thing.
Well, it's interesting that, you who are an educated physician, when first diagnosed, you said, "Oh, that can't be right." And another doctor says, "Well, let's do some tests and see if I am right." Okay, so number one, that means that just because you're a doctor doesn't mean you know everything.
That's right.
Number two, once you got that diagnosis, now you as the patient say, "Okay, now I'm just going to have to deal with MS the rest of my life."
Yeah.
But like I said earlier, you delved right into it to find out and say, wait a minute, I got to know more about this because maybe it is not what they say it is or what I am willing to accept it as.
Yeah.
And that's part of the sermon that I think that we want to preach to the people that are watching and listening is, don't just take everything at face value, because there may be other reasons for whatever the diagnosis is, but there may also be alternative treatments. And I have friends that have been diagnosed with fairly serious diseases that have gone a holistic approach and found that if they just get back to some basics, alter their diet, add certain foods and vegetables and herbs and everything, that sometimes those symptoms that have been causing all of that pain are now starting to subside.
Yeah.
And they're doing it more naturally.
Yeah. I'm really grateful that my mom raised a rebel, because if she wouldn't have raised a rebel, I would have just sat back and said, all right, this is MS. This is what I've got to look forward to. I'll figure this out. And and I wasn't willing to accept that. And, there's always that part of you that goes, okay, what if this is the path? I remember having the conversation with my husband and going, okay, we better figure out what we're going to do with my practice, because if in a couple of years I can't practice, what the heck are we going to do? And he was always so encouraging and saying, you're going to figure this out. You've helped so many women over the span of your lifetime in your career reverse MS. This is a no-brainer for you. And I said, yeah, but this is me and it's different. And he said, it's not different. He said, it's the same. And I will say my one biggest regret during this process of my 18 months was I kept this a very, very close secret to my heart. Like, my staff didn't know what I was going through. My friends, very few of them knew what I was going through. My family knew. But I really wish I would have shared this a little bit more, because had I shared this, I would have had support that I felt like I didn't have. And somebody would have had something to share with me that I wasn't thinking about. And I wouldn't have had to do this alone. But I felt like if people knew, if my patients knew, they wouldn't want to see me. If my practitioners knew, they wouldn't want to work with me anymore, and I would lose them all. And that couldn't have been further from the truth, because when I finally decided to share with them what had been going on and that I had wrote the book, they all just kind of gasped, and they were like, we would have never known. And I said, yeah, I should have told you. I should have told them, but I didn't, because I was afraid. I was afraid they would, if they knew, they wouldn't want to be with me anymore. And that was hard. That was hard to do this by myself and not have a team around me to support me. And they would have been there. So that's the one thing that I would say is to people that are listening to this, don't be afraid to share with people, because there's somebody that knows somebody out there that can help you even when you feel alone.
You're absolutely right. I think the same is true that for people that receive a cancer diagnosis. The first thing is you're absolutely, it's like getting hit with a baseball bat between the eyes. And then you get to that depression aspect of it, that, oh my God, this is it. And I'm either going to just fade with this disease, or I'm going to come out swinging, and I'm going to do everything that I need to do to make it right. And very often, I know, and I think you can back me up on this statement, is that when people aggressively go after whatever disease they're diagnosed with, they are probably in a better place in order to beat it, or at least beat the severity of it and live with it. If you take it head on and you go after it.
Yeah, I agree. I mean, and there's always somebody there that's going to give you that statement, or that you've got this thing when you need it the most and you feel like you can't hang on anymore. If people know, there's that intuition, we all know when a friend needs the call, and we might not know why, but we just got that sense, like, I need to call this person. And then you realize they're going through a really rough time and they needed to hear from you. It's so important to share. If I wouldn't have shared with some of the people that I did, I don't think I would have ever regrew brain matter, because I got to learn about Dr. Goodenow, who's an amazing researcher who's doing brain work. And I got to partner with him, and he taught me what he was doing. And there's just so many opportunities out there for us if we just are willing to be a little vulnerable and share a little bit. You don't have to share everything, but be a little vulnerable once in a while, and you'd be amazed at what comes your way. It's really awesome.
Well, and as a doctor, you've now been able to now write a book about that for other people to see what
Yeah.
you have gone through. And you also become that support arm for people that are saying, oh my gosh, what do I do now? And you can
Hmm.
say to them, let me tell you what we can do. Here's
Yeah.
some options,
Hmm.
and go after them. Do you feel that people aren't true to themselves today in aggressively being an active part of what their diagnoses are? That when you know what I'm saying?
Yeah. I think there is a very big part of the population that just wants somebody to fix them. I have the luxury of seeing all of the people who aren't like that. The people who've dealt with enough doctors long enough that they've figured out that if they don't take control over what's going on in their life, they're going to be suffering with what they have forever. And I think it's once we make that determination, like, I'm just not willing to live life on these terms, that they start taking that power into their own hands, and they start researching and they start finding answers. And that's really when we see the biggest turnaround in people, is when they partner with their doctor to be better. I don't think you can't expect your doctor to fix you. That's never going to happen. We're the knowledge base, but you're the vehicle. It's easy for me to tell you what to do. It's a lot harder for you to actually do what we're telling you to do. And you have to be really committed to that. Like, even for myself, I had to do a lot of things. Some of it I didn't want to do some days. And other days I was like, I got this, I can do this. And those days when you don't want to do it, it's only you picking yourself up to say, I have to do this. Nobody else can do this for me. And if you're not an active participant in it, you can't ever expect to get better.
Are we an over medicated society?
Absolutely. Absolutely. There's no reason we should be medicating people the way we are. Everything's driven by the finances of the pharmaceutical industry, and they make a bazillion dollars off of us. And the more drugs we take, the more money they make. And there's no reason for them to stop creating drugs if we're just willing to be that society where I want a pill to fix me and I want to be better 3 days ago, not 5 months from now. As long as we have that mentality, we're just making the pharmaceutical companies richer.
Yeah, my wife and I very often will comment when we're watching television, the commercials that come on. It's
Yeah.
always shows somebody that feels so great because they took this medication and everything, and they have just come alive. And you say, oh yeah, I should look into that. But then at the bottom of the screen, it scrolls. Do not take this medication if you have this symptom, this symptom, this symptom. It can cause temporary blindness. It can cause this
Mhm.
and that, and even potential death. And you say to yourself, well, if there's all of those, side effects to that medication, why on earth? But that person is just getting paid, obviously, to jump up and down and say, I used to feel this way, and now I feel alive.
Yeah,
And
that is so
you know,
true. And if we didn't have the pharmaceutical companies paying for those commercials, half these TV shows wouldn't be on TV anymore, because that's the only people that are supporting them. And they
yeah,
get all of their money from them. So we have to really question, what are we even watching on TV? Because if they're saying the wrong thing, that pharmaceutical company is not advertising on their show.
yeah. It's so for somebody who is not as familiar with neuropathic medicine, uh,
Mhm.
are there avenues? Are there places, things that you might tell them to look into? Are there websites or books or
Mhm.
something that might be a good starting place?
There are great resources. There's lots of free things on YouTube that you can look for. If you just type in naturopathic doctors, you'll find a whole bunch of us. Everybody's out there speaking. Our website has a lot of great information. It's all free.
Yes.
There's a group called IFM, the Institute for Functional Medicine. They have a ton of great information. And one of my favorite resources is Life Extension. They are a supplement company, they are a lab company, but they are a research company, and they produce a magazine that they can send to you every month. And it will give you so much information about supplements and diagnoses and more than you want to know probably, but it's a great resource, and everything they put on there is accurate. There's never been an article I haven't read that I've been like, this is kind of sketchy. Absolutely never. Great resource.
Okay, and what was the name of that resource again?
Yeah, it's called Life Extension.
Life Extension. Okay. Mm-hmm. And then also, again, folks, serenityhealthcarecenter.com is Dr. Deb's website. And also you have that link to the Let's Talk Wellness Now for some great podcasts and great information and interaction with some of her guests and everything. Dr. Deb, I can't thank you enough for taking the time to be a guest on my podcast. I very, very much appreciate you sharing your knowledge, your expertise, and your passion for what you do.
Thank you so much. It's been a pleasure having this conversation with you.
Well, it's been, the pleasure has been mine. Well, trust me. I always end my show every week with Oscar Wilde, be yourself because everyone else is already taken. And so I will depart that way again, folks. Thanks again for sharing this time with us. Go out, make it a great day. Thanks for watching Someone You Should Know. And again, a big, big thank you to my very, very special guest, Dr. Debra Muth. Thank you.
Thank you.
Someone You Should Know.